Coming up today, tiny wires that reach into the brain. They can make all the difference for stroke patients. We meet one husband and father bouncing back from his emergency. Good Monday morning. I'm Jessica Lovell, and welcome to the Morning Medical Update. When Doug Lewis's daughter found him on the floor, she knew he wasn't acting quite right. She got her mom, who thankfully recognized her husband was having a stroke. Today, we'll meet Doug, see the technique that restored blood flow to his brain, and teach you the stroke warning signs that could end up saving you or a loved one. Doug's stroke was just 5 months ago, and we are so happy to have him joining us today. Doug, good morning. How are you? Good to see you and good to hear from you. Glad you're doing well. We also have Dr. Michael Abraham, a stroke and brain expert here at the University of Kansas Health System. He's also the Director of Stroke Research over on the academic side of things at the University of Kansas Medical Center. We'll talk a little bit about research with him today. He's also the one who performed that procedure on Doug's head and restored the blood flow to his brain. Dr. Abraham, how are you today?
Great. How are you doing?
Good. Good to see you, and nice to reunite you with Doug again.
Yes.
So, Doug, your stroke happened back in December. Can you take us back to that day? You told us that you were having a headache and you had some troubles initially standing up.
Yes. I work overnights, and it was my night off. I was at home all evening, and in the morning I went to get my 5-month-old son out of his crib and feed him his bottle. When I was finished, I put him in his little exercise bouncer toy, and a few minutes later went to stand up off the couch and found it very difficult. Lost all coordination on my left side, and went to take a step forward and just fell forward and ended up on the floor. All I could think at the time was just I had a massive headache, and was very confused, couldn't figure out what was happening, but I couldn't move my left side, and struggled to try and find a way to get up.
Well, and here you are, you're the one taking care of your kids. That's what I'm thinking. You're just there trying to be a dad, and now you're unable to do that. That's got to be a really scary moment. Doug, people say that when you're having a stroke, it's the worst headache you could ever imagine. When you had that headache and then now you can't move part of your body, were you thinking stroke, or were you able to make sense of what was going on?
I was very disoriented. Couldn't really figure out what was happening. Couldn't figure out why I couldn't move my left arm and left leg to, sit up, stand up, do what I needed to do to take care of my son. And it was absolutely the worst headache I've ever had. Just couldn't figure out what's happening.
Yeah, terrifying. So you shared some photos of your family. You told us that your 3-year-old daughter, she finally came in and found you on the floor. Is that correct?
Yes, that's correct.
And then
she came down the stairs.
She went and got her mom, right?
Correct. Yeah, she went to get mom. When mom came downstairs, she recognized pretty quickly that there was something pretty serious happening. Identified that it was a stroke pretty quickly as well, because her father had actually had an incident a few years prior, and she was familiar with the symptoms.
And those symptoms are so important to recognize in our family members. Smart wife, but even smarter little girl, your little 3-year-old running to get mom. You got to really love her for that. So very
Absolutely.
impressive.
She saved Eddie's life.
Yeah, she did. So May is Stroke Awareness Month, and we want people to really know how to spot that stroke the way that Doug's wife did, which is why you should remember this: be fast. All of these could be signs of a stroke. Balance changes, eyesight problems, face drooping, arms that cannot be raised, speech problems, and finally, really one of the most important is T for time, as in time is of the essence, and it's time to call 911. Do not wait, do not hesitate. Doug, you actually have some medical training. You were a Navy corpsman. You have a medical background. So you know these are stroke symptoms, but in the moment, again, you were saying you didn't quite know what was going on, right? You probably look back later and said, yep, that was a stroke, but not in the moment.
Absolutely, yeah. luckily, my wife was familiar and got me help quickly. So.
Yeah, it's really about identifying the other person, because in the moment it's hard to really, self-diagnose, right,
Yes.
Dr.
Yeah,
Abraham?
correct,
So at first, and this is a really important part of your story, Doug, because he went to the ED at Olathe Medical Center, and then he comes to you, and this all happened just within a 2-hour period. He's all the way out in Olathe, and then is able to get to you, so it's kind of fast and quick thinking for everyone involved. You performed what's called EVT, an endovascular thrombectomy. And you brought an animation showing us kind of what that is and what happens during that. So kind of explain what EVT is.
Yeah, so essentially it means going in through the arteries,
Okay.
as we can see on this animation, with catheters similar to this. This is actually not the exact one I took through Doug, but a very similar one into his brain.
Okay.
And this one provides direct suction of the clot. So we get it right to the face of the clot, and at the end this is connected to an aspiration tank, which provides continuous aspiration, and we literally pull out the clot.
And you were showing me this before, because the part at the bottom, if you held it up, is a little stiffer, and then as it gets to the point that's actually going into the brain, it's super, super flimsy, and you can really feel how much motion it has
Correct.
in there.
Yeah, we need to be very soft so that we don't damage the arteries in the brain, because there's always a risk of causing spasm or even perforation and bleeding of these arteries.
Yeah, it's not often we get to see what goes up, actually,
Yeah.
the apparatus
Yeah,
that goes
so.
up inside our brains and inside our bodies. So thank you for the show and tell.
Of course, yeah.
So besides EVT, what other treatments are there for strokes? How have the treatments for strokes evolved?
Yeah, so the first line of treatment is what we call IV thrombolysis, or basically a medication that we can give through your IV to break up the clots. So ideally we want to get that within the first 4.5 hours of somebody presenting with a clot. But if the clot is large enough, sometimes those IV medications aren't strong enough to break the clot. So that's why we have to go for EVT to physically pull out the clot.
So we know all strokes are not created equal, some bigger,
Yes.
some smaller. Where did Doug's stroke land on the scale, if you were describing it?
It was a fairly severe stroke as far as our stroke severity scale. So he was completely weak on one side, speech was affected, those were the main things. So
how quickly are you having to work when you get, he was brought here from Olathe Med, and how quickly are you needing to assess what's going on with him, decide what type of treatment he needs, and get that inside his brain and get him better? How quickly does that move?
Basically as fast as we can. While he's getting wheeled in to KU Hospital with EMS, our stroke team is walking with them on the bed, reassessing his stroke symptoms to see if they've changed from when he came to Olathe to when he got to KU. And we're doing all this work up until he gets to a CAT scanner here at KU if we need to repeat the imaging, and then as soon as we know that it is an ischemic stroke, meaning a clot in the brain, we're moving fast to get him into the angiography suite. Anesthesia's there to get him fully asleep so that we can perform the surgery.
And the key is to be fast, and that's what you were doing from Olathe here, just 2 hours.
Correct, yeah.
So, and that's why you are here with us today, Doug. So you brought some images of Doug's brain, and I just kind of want you to show us what we're looking at, what you were assessing here.
Yeah, so this is a side view. You can see that dark line at the bottom is his carotid artery, and then right in the middle of the circle there should be several blood vessels filling that area. So that's the area, and even going past the circle, it should be filling up with blood vessels.
So the blockage is
way
here,
down there, yep.
and not allowing blood flow up in here. Okay, so
Correct,
then we have another image we want to show you.
Yeah.
So what are we seeing in that little teeny point there?
So that arrow is the tip of this catheter sitting in the clot. So we get it up there, leave it up there, continue suction for a few minutes, and then pull it out.
So this big white is the actual clot. That's what you're sucking?
This is a carotid artery. This is what we call a roadmap image. It's an image so we can guide our devices in there. But again, the clot's there, and that whole area that's gray should be filled with white blood vessels.
And then how soon after you suck it out do you start to see it regain flow?
After about 4 or 5 minutes, we can see it, yeah. Once we get it out, all the way out of the body, we do another injection of contrast, and ideally the blood vessels all highlight.
So let's check out the next image, because this is post-thrombectomy. That's what we want to see.
Exactly. So now you can see that whole area that was missing blood vessels is now full of blood vessels.
So this is the before and after.
Correct, yes.
Great. So in Doug's case, were you able to determine where that blood clot came from? So here's the side-by-side I think we see up here. But were you able to determine where that comes from?
Yes, fortunately in Doug's case, we do a standard stroke workup. We check, basic labs. We also look at the heart. That can be a very common source of clots. So Doug actually had a visible clot in his heart based on the echocardiogram.
So Doug, what has your recovery been like? How are you feeling? Kind of tell us what's going on now.
Well, within probably a day and a half after the procedure, I pretty much felt back to normal. The weakness went away, the headaches subsided, and really it was a little bit of a soreness at the incision site, and mainly just monitoring. At this point, I feel mostly back to normal.
Is it normal to feel back to normal that quickly?
Not in every case, unfortunately. One advantage for Doug is that he's on the younger side of things. So younger patients tend to recover a little bit quicker, but it's always nice to see somebody recover so quickly like Doug did.
So when doctors and nurses assess a stroke patient, they run through a series of questions and illustrations. This is really interesting. This is one of those illustrations. It seems like a random picture, Dr. Abraham. So what is the point of looking at that? What are people supposed to say, and what do they often say? What are you trying to find out here?
Yeah, so this picture here is part of the initial assessment called the NIH Stroke Scale Assessment. This is one of the questions that helps us determine how severe it is. So we're basically looking to see, one, can a person interpret what's going on? Can they see this picture and say, there's two kids trying to get in the cookie jar, there's a mother washing the sink, and the water's overflowing. So that's the second part, is them being able to describe it. So we're really assessing the speech centers in somebody when we're looking at this picture.
So verbally, but also mentally, to be able to say that's what's happening there.
Correct, yeah.
And let's say they can say it's pretty well, and let's say they're mentioning all the things that are happening there. Are they in the clear?
No.
Or is that just the first point?
That's just one of the 11 assessments that we do within a few minute period.
Okay, it's just one way to kind of tell where we're at and try to assess. Doug, do you remember being shown that picture and what you said?
I remember being shown the picture. I don't remember my exact response, but yeah, I do remember the picture.
Okay, just interesting. I was like, what's this random picture?
Yeah.
That's very cool.
Yeah.
Thanks for sharing that. Dr. Abraham, so what puts people at a greater risk for stroke? You've got someone like Doug, young dad, living life, pretty active.
Yeah.
What puts us? Is it hereditary? What else?
There are some hereditary factors, and then there's also the common vascular risk factors: uncontrolled high blood pressure, cholesterol, diabetes, and smoking. Those are the common four things. But then, like I said, in every stroke patient, we look for the heart. That can be a common source. People can have an irregular heart rhythm or heartbeat. And sometimes when we talk to them later on, in clinic, we say, did you ever feel your heart racing or heart pounding? Sometimes that could be signs of an irregular heart rhythm, especially if you're just sitting here at rest.
Right.
Yeah.
So Doug, all right, give it up. Were you healthy? Were you eating right, doing all the things you thought you should be doing to stay healthy? Is there any history in your family?
So I am a former smoker. I quit smoking when I had my heart attack almost 8 years ago now. But also I was pre-diabetic prior to the stroke event. And I probably wasn't doing the best as far as my lifestyle habits. Monitoring those much more closely now.
Yeah, but giving up smoking is a really big deal, isn't it?
Yes.
Anytime somebody says that on this program, I want you to know that is with a doctor sitting here, like, major thumbs up, friend, for doing that. But it does sound like he was monitoring it. Hearing kind of his history of health, was this kind of bound to happen? Is this something that was kind of always going to be a big risk, even though he stopped the smoking and was managing health pretty well?
Yeah, not necessarily bound to happen, but with the history of heart attack, that can weaken a portion of the heart wall. So when it's not pumping fully or properly, sometimes the blood can stagnate and form a clot there. So,
Dr. Abraham, you're director of the stroke research at the Med Center. What research is going on right now? What's exciting you? What are we trying to learn as far as stroke treatment and health?
Yeah, so one of the big trials that we just completed was a SELECT-2 trial, which we talked about not too long ago, looking at patients a little bit different from Doug in that these patients already presented with a large area of the brain stroked out. And before this trial, we didn't know what to do. We didn't know if we go pull a clot out, are we going to put this patient at risk of bleeding or harm? But fortunately, we found the opposite. We found really good outcomes in those patients who got thrombectomy versus those who didn't. So we're starting to already implement that into some of our daily practice now.
I have a question for you. Can somebody have a stroke who has no family history, who's never been a smoker, who has no heart issues, who eats well, exercises well? We hear of that.
Yeah.
Oh gosh, a perfectly healthy woman has a stroke, and it seems like it comes out of nowhere.
Yeah.
How does that happen? Because that's pretty scary.
Yeah, it can definitely be scary. I mean, that's why, like I said, especially in the younger patients or those healthier patients, sometimes they can have genetic things. Sometimes they have clotting factors that are more active in their body that have a tendency to form clots, not just go into the brain, but in their legs, in their lungs, things like that.
Okay. All right, so be sure to ask your questions about stroke to Dr. Abraham, or if you have any questions for Doug, use the chat on YouTube and Facebook. You can tweet us or email the Medical News Network. You can find links to those right there on your screen. Let's get a quick check on our COVID count with Dr. Dana Hawkinson. Yeah. Happy Monday.
I know.
How are you?
Summer out there.
I know. I love it. It's like breathing life into us.
I do like it when it's nice and
Yeah.
warmer than it was in February. So, yeah, right now COVID count 28 active total 28 total patients, 13 active, 1 in the ICU and 0 on the ventilator. So we've had a slight increase in our active patients, but also now have 1 back in the ICU with severe disease. So.
Okay, Doc Hawk, question for you. Last week, the CDC released its 2022 data on overall COVID deaths. Overall deaths in the U.S. dropped 47%. Around 245,000 people died from COVID in 2022. Still a high number, but it was down from 462,000 in 2021. The report also gave details on things like age, underlying health conditions. As far as this report goes, what stands out most to you?
Yeah, I think you're right about the first part about age. So we know that the lowest deaths were among those that were under 14 years of age, but highest among those that were over 85. And we have been saying for a while now that this disease is really becoming a disease of those comorbid conditions, most notably age, but also other immunosuppressive conditions. The other things that stood out were just the disparities in the United States, which we know of and we continue to hear about. So the lowest death rates were in Region 1, which is basically the Northeast, Connecticut, Maine, Massachusetts, Rhode Island. But the highest death rate was in Region 6, which is things like Arkansas, Louisiana, Arkansas, Louisiana, New Mexico, places like that. There were also in Region 4 highest number of deaths, and those are places where we know that there are more socioeconomic and access disparities and discrepancies for those populations in those areas, places like Alabama, Florida, Georgia, Mississippi, South Carolina, Tennessee. So, we know that there is a lot of work to be done. We need to increase the public health infrastructure. We need to increase the access to care and education of communities around the nation, but especially in those areas where we have seen the highest number of deaths and highest death rates as well.
All right, Doc Hawk, thanks for breaking that down for us. Any reporters with us today? Let's get to our community questions because we've got some good ones. Question from Yen, mentioning that there's seems to be 2 main methods of removing blood clots: intravenously administration and also thrombolytic agents. So curious, what method is more commonly used in the United States? Which one's safer, or does it just depend on the severity of the stroke?
Severity and the timing, because right now we can only give the IV thrombolytics for the most part up to 4.5 hours.
Okay.
We were in a recent trial also looking at that, giving that up to 24 hours, and we're waiting on the results of that trial.
So there's advantages and disadvantages of both, just based on where you're at.
Correct. Yeah.
In your situation. Jean wants to know, what is the best treatment and preventions for TIAs, and tell people what TIAs are.
Yeah, so TIA stands for transient ischemic attack. It's like a mini stroke. You have stroke symptoms, but they resolve very quickly. So if you do have a TIA, it still can be a medical emergency because that can put you at risk of having a stroke in the near future. So I would recommend seeking emergency medical attention, because a workup may be indicated, again, to look at clots in the heart or other things like that, which could change what medications you're on, which would ideally prevent you from having a full stroke.
Doug, Yolanda wants to know, on your way to the hospital, did you take aspirin? Was there anything you were told to do in the meantime from home to the hospital?
I don't remember if they gave me aspirin or not. I was still pretty out of it at that point. Yeah, I don't recall.
Dr. Abraham, is that something we hear that have aspirin handy in your purse if somebody needs it? Is that something people do or should do?
With strokes, it's a little bit different than a heart attack.
Okay.
Because with a heart attack, it's always a blocked artery. With stroke symptoms, it could be either to a blocked artery or a hemorrhage. And we don't know that until we get the CAT scan.
So hemorrhage, you don't necessarily want that, correct?
Correct, yeah, because that could potentially worsen the hemorrhage.
So what is your advice for people then? It's better to err on not doing it or to take the chance and do it?
I would err on not doing it, but just, again, call 911 ASAP.
Okay, good advice. Stu wants to know, can the brain heal itself after a stroke?
Yes, there is a concept called neuroplasticity, and that involves, intense physical therapy, occupational therapy, speech therapy, and working with our rehab docs. Ideally, after a stroke patient leaves KU, if they need it, they'll go for inpatient rehab, which is very important. Additionally, we're also in some stroke rehab trials on the other side of the emergency side of things. So with Dr. Sandy Billinger, one of our rehab medicine PhD docs, we're in a study looking at patients with strokes and using a device where they place over their head to try to enhance neuroplasticity and help patients recover.
Back to hemorrhagic strokes, Paul wants to know, why are they more dangerous?
Because with hemorrhages, they can also worsen. And with hemorrhages, sometimes they can cause more mass effect on the brain, cause things like herniation, which can cause a lot of swelling in the brain.
Lynn wants to know, if time is of the essence, why not do the thrombectomy or some type of treatment at Olathe or the initial hospital somebody would go to? And in this case, it was Olathe. And a big shout out to them for making sure he got down here to the care of your team.
Yeah, so great question. Yeah, so unfortunately, not every hospital has thrombectomy capabilities. So there are 3 comprehensive stroke centers in Kansas City, with KU being one of them. So we can provide 24/7 care. We have 5 neurointerventionalists who are able to perform this type of surgery, at all hours of the day.
And question for you, because recently you have been required to track these type of strokes a little bit more.
Correct.
Tell us why and what you're hoping to learn from tracking these hemorrhagic strokes.
Yeah, so great question. So being part of being a comprehensive stroke center through the Joint Commission, they are tracking us from the moment the patient hits the door, when the stroke team arrives, when we get the CAT scan, when I get access into the arteries, get to the clot, pull it out. And all of this is to, track what we're doing so that we know we're doing above and better, what's recommended, and just to keep doing a better job at this.
And Terry wants to know, is there, I think you've mentioned this, but just go over it again, where an EVT does not make sense. You would not do this type of thrombectomy with every stroke.
Correct. There are still some areas, of the brain that we're not sure is it safe to go in. And when I say that, sometimes some of the distal, more smaller arteries, which is also another trial that we were recently invited to be a part of, to look at these patients who have smaller clots and seeing does thrombectomy versus medical management help their outcomes.
I want to get to today's takeaway, and I want to start with you. People listening at home, I just think stroke is really scary. Kind of like in Doug's case, it just kind of comes out of the blue. You could be driving, taking care of your kids. I mean, what if his wife wasn't home at the time? There's just all those things, I'm sure, go through people's heads. What do you want people to take away from this talk today?
Be fast. So being able to recognize those strokes, stroke symptoms. We all, for the most part, know what a heart attack is, but I mean, Doug, it's amazing that your daughter, recognized something was off, called your wife. That's brilliant, I think. So I think just being able to recognize it and then call 911 as soon as you can.
But would he have been able to get to a phone call or make a phone call? Or I guess this is where the 3-year-old is key, making sure our kids know how to dial 911, right? That's another cautionary tale to talk about too, right?
And with Doug's aphasia, his speech being affected, unfortunately, would not have been able to make that call. So,
for the type of treatment though that you gave to him, could he have been too old or too young for it? Is there an age limit, or for what he needed, were you able to do what you needed to do?
Correct. Yeah, he was. We really don't have any age limits. The youngest patient I've treated was a 5-year-old several years ago, and the oldest was in the upper 90s. So
Okay. Any last advice on just keeping our bodies healthy and keeping away from your operating room and not having to meet you other than right here at this table?
I think, having a good primary care physician so you can have those routine health, medical, and maintenance exams done, because that's really important. That's what we're trying to do, is prevent you from having to see me. So
yes, okay. We just want to see you right here, sitting here giving good advice. All right, Dr. Abraham, thanks so much for being with us today. Doug, what do you want people to take away from your story?
I think it's important for everybody to know the signs and symptoms of a stroke, because even myself, having a medical background as a medic, I didn't recognize it myself. So it was important that my family was able to do so.
Yes, your family needs you around, so I'm so glad. And again, huge shout out to you for giving up smoking. That was key. So thank you so much for sharing your story. And just with your story, and be fast being really the word of the day, let's just look at it one last time. If you are with someone you love, look for these signs: balance, any changes in your eyesight problems, face drooping, arms that cannot be raised, speech problems. Remember T for time. Time is of the essence. Teach your children how to dial 911 only when they're supposed to. These things are really a matter of life and death. So please, hopefully this reached somebody today and we can save lives.
Yeah,
thank you. Thank you so much again, Doug. Thank you. And thanks to all of our viewers and your great questions today. We will see you back here tomorrow at 8 a.m. Coming up tomorrow on the Morning Medical Update. When Kaylee Hobbs calls her son's name, she thinks of the doctor that put her cancer into remission. I'm Jessica Lovell on the next Morning Medical Update, the special tribute from this patient to her physician, adding his name to her family tree, Tuesday at 8 a.m.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stites podcast. Now, everywhere podcasts are available.